I want to welcome everybody to the meeting, and we're going to try to get started as soon as possible so that we can finish our agenda, hopefully not keep you for too long. So as of this morning, we have 664 people on Team 10, which is huge. We have people from 45 the last time.
In the cloud, yeah.
Storage thing.
Right.
Zip thing or whatever.
Oh, a thumb drive or something?
Some kind of like that.
A zip
They
drive?
found child pornography too.
Mm.
So the guy's got problems.
We have
Muted everybody so that you can hear me. Obviously, if you want to talk, please unmute yourself. So we have 664 people on this team now. It's growing by about 20 per day. We have representatives from 43, I believe, or 45 or so schools from all over the country, anywhere from California to the Northeast. We have people that are currently either medical students or they are college students that are participating in this team. And 175 people so far have completed the AASHTO course, which is great, and I hope more to do. I think the only message I have for today is remember that we need to get to the thousands. We're actually going to be probably over 1,000 by June, but if everybody can, especially those of you who are part of a school, if you can talk to your dean, you can talk to your fellow students that want to join, convince them to join the group. We don't have a specified commitment of time. You can devote as little or as much as you want. But the state of affairs currently with the state of Florida, and I can't speak for the rest of the country because different areas of the country are more prepared than others. In the state of Florida, they're still not hiring contact tracers locally. There is no job openings in Miami, for example. There may be job openings in other parts of the state, but as of now, they're not hiring. So we're it. And we need to deploy hopefully by June 1st or sooner. And that's what the meeting is about today. John is going to go over the app and everything else, but it's just urgent that we get involved because government is lagging, understandably so, but that still puts everybody at jeopardy, especially when we're reopening and we have no contact tracers, at least not in South Florida, that are either employed or volunteering. So having said that, I'll turn it over to John.
great. Thank you very much, Dr. Michel. We are moving ahead in this. We are going to be sharing our third. Can you please mute?
Just pet him every
It's an
time.
empty bag, throw it away.
No.
Can you all mute your mic?
Everyone mute, please.
Thank you. We are in our, we're going to be unrolling today the third aspect of the app, and that is collecting information from contacts of the COVID positive patients. So this will be the third, and I'm assuming the final aspect. That doesn't mean that there won't be some updates to the app as we move along, but at least we'll be prepared to start making phone calls. It's a very crucial week, so we will be showing you that aspect of the app in just a little bit. I wonder if at first, is it possible to find out how many people are here for the first time? Is that possible to know? I don't know how to do that.
Actually, why don't, whoever's here for the first time, you can unmute and say you're here for the first time and say your name.
I'm Dudlin Senafils Brutus.
Thank you.
Yeah, I'm Tariq Al Hakim. Also, I'm new here.
Hi, I'm Faraz Rahman. I'm also new here.
My name is Isha. I'm also new here.
Hi,
I am Martina. I'm new as well.
Yeah, I'm Miguel. I'm new as well.
My name is
Mikael, and I'm new.
My name is Rose. I'm also new here.
I am Stephanie, and I'm new here also.
Hi, I'm Tasha.
I'm Christine, and I'm new here too.
I'm Masara
Hi, I'm
Tusa,
Alexia.
and
I'm
I'm
new
a
here.
student, and I'm new here as well.
I'm
My name is
Tasha.
Andre.
I'm new as well.
I'm Andre. I'm new here as well.
My name is Karina and I'm new here as well.
Guys, I'm Jasenia and I'm new here.
I think
Wow.
that's probably about 20 people, John.
That is great. Well, welcome to all of you, and that's helpful. I want to be sure that you get an overview of the app. So we will go from the beginning. We might go quickly through some of the early stages, but if you want more clarification, please reach out to us. We want to be sure that you understand the app. And you will be getting documents also at the end. I will make them available both here and in the Telegram. So please be sure that you're signed up for the Team 10 Telegram, because the scripts that you will need for the for implementation of the app will be available there. And also, for whatever questions you have at using the app, for both the new people and everybody, please put them right there on the Telegram. Sometimes the point person will be responding, and sometimes you'll get a response from another volunteer, which is perfectly fine to do because that helps us to build the app. So please use the Telegram. That's really important. And that helps us. So what we're going to do next, we'd like to do a little bit of exercise to sort of see who people are or where people are in the progression or the understanding of the COVID Fighter app. So some of you who are new, you probably won't know some of these answers, but if you've been through the AASHTO training, you should know some of these answers. So please respond to the answers. It's not a test. It's really more for fun and for our community, for conversation. So who is putting up the poll?
Wait, this is Virginia. Can I just say something before we do, please? Hi, everybody. For the people that are new, welcome. And for the people who have been along this journey with us, thank you. I'm just going to remind everybody that this has been a work in progress. You have literally watched it be created from scratch, and there's struggles, there's growth, there's challenges, there's successes, and each step along the way presents a different challenge. And thank you all for stepping up and for participating and for bringing your insight and your intelligence and your logic and your emotion and all of it, because it's all been necessary, and we thank you. What we put together was, we're calling it a poll because it's the question that we do for this, but it's kind of just a multiple choice. We could have put together 500 of them, and we just picked 10 just to talk about this today. The training is almost finished. We're hoping to have that next week and for everybody. So a lot of this you'll find the answers, but we thought maybe we'd kind of just see what everybody's thought process was and what their confusion is, and just trying to straighten out some issues. But remember that there's a whole lot of issues. We can't anticipate every possible scenario that's going to take place. So hopefully this will be kind of a critical thinking process that will apply to other specific scenarios. So if you guys can all see the poll, there's 10 questions. Just take your time. We're going to give about 10 minutes, I think, because some of these are going to take more thought process than others. And just go through and click your answers. I'll know, I think, coming through here how many are done, but it's 1:15. Let's see how far we get in the first 5 minutes. Okay, so ready, set, go.
All right, John, you're up.
We're doing the poll right now.
Okay.
If you have questions, so we've put in there the word Tracy. That can also be, you can think of the patient, which we've used in the past. So Tracy or PUI, patient, all the same right now. We're working on that wording, but don't let that confuse you if you don't understand what that is. It's PUI or patient, Tracy.
PUI is patient under investigation.
For question number 8, where it says that we can select more than one answer, I'm not able to select.
No, they all have one answer
Okay.
only.
Actually, some Virginia, some allow more than one answer.
Some of them don't.
Some of them do. They can
Yeah,
check one answer, but they
the
can check
number
more.
6, it has more than one answers, I think.
Select more than one.
Okay.
Not able to
Each
select
one
more
says,
than one
yeah,
option.
each one says how many more answers you have. You can add.
I mean, we're literally going to go through and talk about each one of these.
I'm having trouble moving it down.
Can you scroll it? Does it with your finger? It doesn't move with your fingers?
There's a scroll right to the right of the percentage. I mean, to the question.
I couldn't get it to come up. Okay.
For those of you who are joining, we're just taking this poll right now. And FYI, we're 4 minutes in and we've got 37%. So thank you.
For question 8, it says that we can choose more than one answer, but we are unable to.
You can just choose one, and that's okay, because this is more for discussion afterwards, so that's fine.
Okay. Thank you.
Virginia,
Mm-hmm.
have you checked my, I have already done, but there is difficulty to submit that.
No, it just done. Apparently, when the whole thing is done, I hit end polling and then it'll stop everybody. We're now at 63% and we're 6 minutes in. And I realize that for the new people who haven't been even done the certification, that this may be completely new to you. So this isn't a test. It's just a conversation starter.
I just want to confirm I have done this pool. Have you?
Okay. If you've gotten through all 10 and checked it, is there something on your end? Does anybody, when you guys finish, is there something you're supposed to be doing or no?
It says submit. It just says
Okay.
submit.
What's the percentage, Virginia?
We're at 75.
Yeah, it might be okay because
Well, is anybody like on the last one, or I don't want to cut somebody off if they're close. I'll give you another like 30 seconds.
I know the new people probably weren't able to join it.
Okay.
Dr. Rana, are you on here?
Yes, I am.
Would you do a favor and just be sure and post here, and also again in the tracer, the link to the ASTO training. So if people haven't done that, that they just another reminder of where it's at.
Okay.
Thank you very much.
Okay, I'm gonna end this now. Okay, and does it come up on your screen? Oh, share results. Here we go. So can you see this?
Yes.
Okay, great. So let's go through it. So Camilo and Alejandro, we got 26% say that the app is easy and 71 say somewhat easy. So for the people that are 71%, if you can help them understand why it's not very easy, that would probably be very helpful. But I'm happy to see that, look, 3% say it's not easy at all. So that's really, really good. Really, really good.
And
Okay,
any questions on that, you can put them in the Telegram. If you're having problems using it, just put it in the Telegram, you'll get an answer.
Okay, number 2. The role of as a contact tracer is to provide medical advice to the tracer, monitor the tracee and gather information in order to help mitigate the spread of COVID-19, advise the tracee what might happen if they don't comply. 99% of you. And that's our role, is to monitor the tracee and gather information in order to help mitigate the spread. We're not to give them medical advice, and we're not to tell them what happens if they don't comply. Any questions on that?
No.
Okay, on number 3, if a tracee tells the CTS they're experiencing shortness of breath, what does the CTS do? One person said, advise them that you'll call them back. Ask them about their other symptoms is B. And C is tell them to either call 911, go to the hospital, or to contact their primary care physician. If somebody's telling you they're having shortness of breath, we have to tell them to do something about it. Call their doctor. Once we start asking about that other symptoms, we're kind of diluting the shortness of breath, which is a huge symptom. Any questions or comments on that?
No, but it's a great reminder. That comes up a lot about what happens when I hear that or see the alert and the responses. It's not our role to give any medical advice. That's again, that is to get them to talk with the professionals.
So number 4 is along the same lines. What do I do if I, as a doctor, know the medical answer to a medical question being asked by the tracee? Okay, I'm not a doctor. Give them the answer if I am 100% sure of the answer. So 29% of you aren't doctors, so this doesn't apply to you. Give them the answer if I'm 100% sure of the answer. Do not give them medical advice, but advise them to call their PCP. Advise them to look it up on the internet. I'm glad nobody did that one. So the B though, even if you are 100% sure of the answer, your role in this is to not be a doctor. So you have to advise them to call their PCP. Any questions on that?
I think that's a really good point. It may be hard to not give the advice when you do have the answer, but it puts you and us and them at risk.
Okay, number 5. May I tell a contact for a CTS the name of the tracee or the person who gave me their name? No, it's never okay to give the name. You must advise them it's confidential. Under some circumstances, you may, if you have permission from the tracee, it's okay to give the name. So even if you have permission, what we're saying is we should not be giving it to them, that it is confidential. And so Dr. Michelle or Sean, if you guys want to weigh in on that, is it a black and white line?
Yes, it is.
Yeah, absolutely, categorically.
Yeah. So the issue is that if word gets out that someone gave the name to someone else, that our tracers are doing that, it's going to basically cause a lot of people to wonder whether they really want to be traced or not, and whether they want that information disclosed or not. And sometimes in the middle of a situation where you just got diagnosed with COVID, you might say things you don't mean. So you might say, you know what, yeah, you can give them my name, but you really don't want that. So the last thing we want to make sure that the public knows that we're not going to give any names, even if they tell us we can give the names, because we need to protect their confidentiality. That's the main reason.
And let me just.
What about if somebody says, you have to tell me who it is or I'm hanging up. I don't believe that I've been exposed.
Can I answer this, Jack?
Yeah.
Okay. So in these particular scenarios, conceptualism is the most important thing. And understanding that is that the current distrust in contact tracing in the United States can be overcome just by being trustful. So with that being said, we all have to make sure that we do not compromise anybody's personal information and sharing their information. And when in doubt, if it's going to be either HIPAA violation or no HIPAA violation, pick the one where there's no HIPAA violation and let the call end, document what occurred, and we move on, because we can't even go near any type of HIPAA violation.
And then lastly, in the document, in the release that they sign, when they sign up for the app, we tell them we're not going to share their information.
Right. So,
if they read that, they know it, and we have to stick to that.
I think Nancy Joe's question was, if you call someone, it was a different question. It was, if you call someone and tell them you got exposed, how do they could say, well, I don't believe you. I don't know who you are. That's what you really meant, right? Nancy Joe, you weren't talking about the tracee. You were talking about the contact.
That's correct. That's correct.
So that's possibly going to happen. And that's why in the scripts, we're making sure that you say you're calling from a hospital, and we're saying all those additional words because we think that that's going to possibly give you more credibility. Is it going to happen in some percentage of the time? Probably. I think most people, when, with the current awareness of what's going on, in the media and all that, are probably going to want to listen. But you always have the small percentage that still think this is a government conspiracy and that, we're trying to follow them or something.
The other thing is jot down the information, timestamp it, and send it to us. And what we'll do is, if anything occurs in that one tracee's case that requires us to take the thing that, somebody mentioned one male or female, you could try those like generic data points like male, female, age, sex, and no name. And what you do is we report that. I'll take that to the health department and say, look, we have this case. They know of a contact, but they didn't give names. We're going to give this information to you so that you guys can do your due diligence on that case that is suspected, like a PUI that we haven't been able to contact without name. They'll do that.
We'll get into those details, later, but and then we'll train you on that. But I think the main thing you need to keep in mind is, just from a common sense standpoint, is how likely is that contact, to expose other people. So, for example, if you have a contact that says, well, I work at a McDonald's and I'm there serving the public, but I'm not listening to you. We need to talk about how we deal with that, because there may be situations in which some people are just exposed to a lot of people. So those are the things we're going to kind of learn as a group: is, are there hotspots? Are they areas that we need to alert authorities as far as risk of transmission. But that's a whole separate subject. But anyway,
Yeah.
go ahead, John.
Okay, all right, number 6.
Virginia.
Is it ever pardon me?
Okay, we have a question. Someone's saying if you don't have a PCP, who should you tell them to contact?
911.
Okay.
Or go to the nearest emergency room or
Yeah, or urgent care clinic or.
Well, yeah. The thing about 911 is that if they respond, they're going to have care within minutes to be checked, and then they will be given a form that says if you don't want to go to the ER, sign this form. If you do want to go to the ER because we are suggesting it, then let's go. So it'll be built in that way. So you could refer to the hospital as well, but there is telemedicine law that states that if somebody is altered or has an issue and you recommend them drive, that could put you at legal jeopardy because you're telling them as some sort of a source, medical source, to go drive. It's like when we had cases where people accidentally overdosed, we can't tell them to drive to the hospital. We literally say to them, we can't tell you to drive to the hospital, get somebody to drive you or call 911. So you could phrase it that way, get somebody to drive you to the closest emergency department or call 911. And that would be the end of the call, and it would save everybody any difficulties or confusion.
Okay, well then that flows perfectly into number 6. Is it ever necessary for a CTS to call 911 when speaking to a tracee? No, we must always leave that up to the tracee, only when there's a medical emergency, which defines something that requires immediate medical attention, or C, when the patient advises that they have had shortness of breath for 45 minutes. And I mean, you just heard the discussion. I don't think anybody would call 911 if it's a 45-minute shortness of breath. Does anybody disagree with that? We would.
I wouldn't assume that. I wouldn't assume that. I would just go with the blanket and let the paramedics or the hospital or whoever's involved take care of the call from there. The second that gets proposed is the second we start posturing to leave the call so that the patient can get higher level of care.
But when somebody says I have shortness of breath, does that mean we're calling 911 every time they do?
You have to suggest it. If they deny, then that's fine. They can deny and you can continue the call. But as long as you stated it, and if it ever comes down to need to be documented, or I think we should document, that's why we talked about this a few weeks ago, but we should document any call that becomes like this. There'll be small numbers of those calls, but it'll allow us to do quality assurance and following up to make sure that the call was handled correctly with no legal blowback.
And the other issue is if I'm a tracer and I'm in Miami and I'm tracing somebody in Texas, my 911 call isn't going to do anything anyway.
The cell phone towers and the technology that exists there, it's hit or miss, but the best thing to do, if you want to go the extra step, which I don't recommend, but you can, is just jump on Google, find their zip code, find the police department for that zip code, give them the non-emergency number. It goes pretty quick. It only takes about a minute. And then that'll get them to the care they need.
This is why it's going to be important, and this will be part of the training, that before you pick up the phone and call somebody, you need to have their information in front of you. You need to have their name, their address, their phone number, their zip code looking at it when you pick up the phone, so that if you have anything that you have to deal with, you know it. But again, that'll be in the training.
And the other
yeah, excuse me. Are we going to be also putting down their current location, because they might not be at their address at the time that we're speaking to them?
I think part of the initial conversation with them is confirming who they are and confirming their location.
And we have their
number. Right. Their current location.
Right. Ask a quick question regarding number 6. Just to be certain then, we never call 911 for somebody. Is that correct?
No, that's not correct. If they need assistance, you're allowed to ask them. If you find them stuttering or having difficulty to communicate, you say, would you like me to call 911? And then that's when you implement, take their zip code, if you're already going to know if they're home or not, and then you contact them. The other thing I was just going to say is that Chatcom is a new technology that most 911 systems are adopting, which means that you could text from any phone. It'll go to the closest 911 service. But you have to be careful with that, because the level of care, like that would be like a 45-minute shortness of breath call. You know, like say, if you want, you can't call because you're concerned about the connection, then text Chatcom, and I'll put that in the review. But Chatcom to get help, and then somebody will pop on and then instruct them from there.
And Sean, when will we get those reviews? Because we're finalizing these manuals, so we need those ASAP, please.
Yeah, I'll do them today.
Yeah,
Thank you.
so quickly, Virginia, this is Obi. Let me just interject quickly. Paul, that was a good question. And it's just like if someone is having a stroke and you happen to be on the other end, so you could, help them make that call. They just, so it's perfectly allowed to do that. Thanks.
Thank you. Okay, so what, on number 7, what does the CTS do if the tracee is a minor? You talk only to the tracee, talk only to the parents or the guardian of the tracee, obtain permission from the parent or guardian, and then speak directly to the minor. Obtain permission from the parent or guardian, and then always try to include them in the conversation, which completely makes the most sense. You don't want to, you need permission to talk to the minor, and you need an adult there kind of helping with the questions and the answers. But you also need to speak to the minor if the minor is old enough to be spoken to, so you can get their words of what they're feeling and what they're doing.
So let me interject here. So if the minor is 16 and allowed based on latchkey laws, is allowed to be home by themselves, and you are doing the contact tracing, you have to first present the statement that they're under 18, they're a minor, if they're not emancipated, because remember, some minors are emancipated. They're on their own by law. It's 16 and over, so, and sometimes it's younger. But the thing is that you'll be able to address that and be able to still speak to them, as long as in certain cases where we need the contact tracing, we're going to have to tell them, if you feel that you're allowed to take this call, please make sure that you tell your parents that we had called, here's the number, call us back if they have any questions regarding or pertaining to the conversation. So there is still a window there that you can still communicate with them. Now, if there is a 16-year-old as an 18-year-old sibling and we're talking to the 16-year-old and you say, is there an adult in the house 18 and over? And they say, yes, my sister's 18. Then you say to them, please allow me to have permission from your sister to speak to you. And then she'll assume the responsibility of care and tell the parents. So the continuity doesn't get lost that way.
Okay. 8, what is the acceptable proof of a COVID positive diagnosis for plasma donation? Okay, so what the implication on this is that we're asking from the patient to give us proof of their diagnosis. It isn't necessary for us to do the tracing. What is necessary for is if they're going to donate plasma, or even just the health department records, there needs to be a record of it, but definitely for the plasma donation. But while the question is in the app, it isn't a requirement. But so if we have to get acceptable proof because they're going to donate plasma, what is acceptable? So clearly the best one are the actual test results from the lab. If the tracee clicks yes to the question, that's not enough without having proof. If the tracee is on the phone with the interview and they say, oh, I got a positive test, that's not enough to say that they are. The second choice is the letter from the tracee's physician attesting that they are positive. So those are the 2 acceptable proofs of the diagnosis. Any questions there? 9, how long does the tracee have to remain in isolation? Until all the symptoms are gone, for 14 days from the date they began to experience symptoms, or when they're feeling better? And there is an answer, which is B, 14 days from the date they began to experience symptoms. We can't advise them just to leave the house when their symptoms are gone if it's only been 7 days.
Virginia, I'm sorry to interrupt. Can you please confirm the answer of the previous question?
Of course. On number 8, the answer is A, actual tests, and D, a letter from the tracee's physician.
Okay, thank you.
Sure. And then the last one, again, we've talked about this. If a tracee tells the CTS that they're experiencing shortness of breath, as well as chest pain and or loss of consciousness, what does the CTS do? Because there may be times when they're telling you they have shortness of breath and it's not an emergency call. But if they have shortness of breath along with chest pain or loss of consciousness, noted on the app. B, keep the tracee on the phone and see if their symptoms improve. Immediately hang up and call 911. And that's the answer. We can't just keep them on the phone and hope they get better. And you can't just write it down and do nothing. And all of this information will be in the training manuals but we just kind of wanted to have this discussion today and raise these issues and see the types of things. It's like I told you, we could have done 100, 500 of these questions.
Sorry to interrupt, but what if the symptoms are there beyond 14 days? Then they have to be isolated, right?
So
Extend isolation.
I'll answer that. This is Dr. Sean. In the event that somebody is having, regardless of the time frame, is having a medical emergency, which we are defining as shortness of breath, loss of consciousness, sometimes, and seizures, because that's going to be up to them if they want to take care of that, and chest pain. And the reason is because if you stay on that phone with them, it's going to be interpreted you're assuming care for them. And if you have an MD, RN, anything, MS, whatever it is, it becomes very complicated for your license. So again, the critical thinking skill here is when in doubt, it's dangerous, call 911. Do not proceed any further and document it.
Thank you. Thank you all very much. Thanks, Virginia, for leading us in that and for the discussion. We'll be doing more of these as we keep going along to help us talk as a group together about some of these common questions. But we are also in our app, and in the training, we will answer these questions, and we will have sections in the app and the manual that have frequently asked questions. So everything will be available to you.
And you could email Sean or call Sean on the number I left in the chat room anytime you want with any questions. I'll take care of it.
Okay.
Dr. Ryan Capel, I have two questions. Should I leave them for later?
Go ahead. If they're pertinent now, go ahead.
Okay, so someone's asking if for the oral consent, do we have to record the call?
If it's what?
For the oral consent, if you're taking consent from someone, do we have to record the call?
Does anybody have that answer?
Wait, let me ask clarification. You mean consent to speak because of a minor, or because they've signed a consent for us to speak to them? They've already agreed to that when they signed up for the app.
Okay, Sayeda, could you just unmute and ask your question?
I think it's in context of if it's a minor
hi.
and you get oral consent that yes, the parent is saying, yes, I'm there. Can they?
Yeah, I asked this question, especially in case of minor. So do we have to record the call, or we can just go on after getting the oral consent from the guardian or from the elder sister, just the example Virginia gave us? That's what my question is.
I mean, Sean, you can correct me if I'm wrong, but I don't think it needs to be recorded. I think you need to note it in the app in your notes, but I don't think it needs to be audibly recorded.
That's correct.
Okay, thank you.
Jot it down.
Thank you so much.
And Dr.
To the admin.
Okay.
Okay, the second question is, if the symptoms persist more than 14 days, do you continue to monitor as a tracer, or do you still leave 14 days? I mean, you're done at 14 days.
That's a good question. I don't know how long our app allows, if it's only 14 days long, but we'll ask Camilo. Is Camilo here?
Yeah, I don't think that's to Dr. John Capel. Well, that's thank you for handling that. So some of these things will be discussed more during the skill lab. As you all know, there's issues around COVID-19 is always evolving. We want to be sure we have the right information for you. So we'll take note. I'm actually going to take note of that question, and we're going to address it during our skill lab. So over to you, Dr. John Capel.
Okay, Camilo, are you online here? Okay, well, our next, what I want to do is I want to show the updates on the app. So I'm going to share my screen and get this up for us. Give me just 1 second to make this work. So I'm not going to be able to, are you able to see my screen? Has it come up?
No.
It says host is disabled screen sharing. Can that be enabled?
Yeah, Virginia, Dr. Mitchell, who's the
I've got it.
host?
I've got it. I've got it.
Okay.
Okay, so here's, for those of you who are new to us, I imagine maybe you have signed up for the app and you have it. So this is what it looks like when you sign in. Now, I'm signed in already, so I can't go through and show the patient side. So for those of you who are new, hang in there with us. But for purposes today, I need to be able to show the contact management or the CTS management page. I want to show you a few aspects of this that are new. We want to be able to have it in the workflow when you have finished with a client, with a patient or a tracee. There's this button here called Not Ready. We're changing that name to say Ready for New PUI. And you will click on it and it shows over here whether you're ready or not. But you would just click Ready, and that sends a message through our system to say that you're ready for a new person, and you will get assigned a new patient. So that's a new feature on our app for the contact management page, or for the CTS management page.
John, if I may just add to that for a second, because I want everybody to understand that we know that you're volunteers and we're trying to respect your time, and that's why we've asked you to tell us how many hours a week that you have available to do this. So this method will allow you to say, I'm ready for somebody else, and if you don't click ready, you're not going to get a new assignment. So you're going to be able to have control over the amount of time that you put into this project. And we obviously would hope that you could put in as much as you can, but we don't want to burn you out. We don't want to overload you. We know you have other things to do. We respect you as volunteers. We appreciate it. And we're trying to work that into our system.
John, Camilo just joined, just so you know.
What's that?
Camilo's on the line, just in
Okay, great, Camilo, thanks. If I run into problems, Camilo, you can help me. So this is the it's a CTS management page. So this is your dashboard for when you're working with the PUIs. And you can see here the magnifying glass. This is going to take us to this patient's page, but this gives you a review of what's going on. So you can see that it says here that I've not reviewed this person's information. They have not submitted positive, and I've already received a time alert, meaning that they've submitted a report, but I haven't reviewed it. So that's giving me a snapshot of what's going on with this patient. But to get a better idea of what's going on, let's go into the patient's page. And here we now have some new information. Over here, we have intake information. It used to say, I think, reviewed. This is just to say that, have I reviewed or not reviewed all of their intake information? So I know whether I've done it or not, and I can check that. We also have, if they are, can know if they've submitted or if it's in review, not submitted, it's in review, or submitted their COVID-19 proof. We can also know what region that they are in. And then we've added another one here. This is a new one, patient status, because we want you to be able to know if you're in the interview process, meaning collecting information from the PUI, if you're in the contact interview process. So this, you're still contacting their contacts. And then when you're done, you can push inactive. This is also will be connected to the region head so that they can have an idea of where you are. And if it's taking a long time to do some of these, they can make contact with you and say, do you need some help with this? Maybe there's 100 contacts there instead of just 2. And it may be better to team up to be able to finish this one. So these are here for your use and to add some quality controls in here for us as well. So so those are some new features on the app that we've added. Here you'll see, any questions about that at this point? Great. Here, this is all the same. We'll be changing this instead of nation, it'll say nationality. That's what this is. Again, I have not put the address in for this person, but you can click on the edit and then you get a pop-up there. So I can then either, when I'm talking with the person, get the address if they want to give that. If we need that, I can put that in at any time. And then the phone number, same with the primary healthcare provider. And then you see we have the questionnaire that we have hopefully have done. Clearly I haven't done. So for those of you who are new as a CTC, these are the questions that you'll be asking the COVID positive patient. You want to find out when did they first suspect their infection. So you'll put a date in here. And you just always push the save button and then it populates it here. So you'll be able to go back to your page. The edit here with, so I had fever and cough.
Just, it's showing like that for John because he's done it before, but it wouldn't show like that for a brand new patient.
What would show up as a brand new patient? Oh yeah, there wouldn't be, yeah, all of this wouldn't be here yet because I haven't signed, because you hadn't signed in. Right?
Yes, it will show the red marks for somebody that's brand new.
Okay.
And the check marks, it will be single check.
Okay.
We fixed that already. But I guess for yours, since you've done it before.
Yes. And I need, this is for the, because I needed this filled up for the next step. So you can see for those who are new, you'll be asking these questions. This will be red until you fill something in. And you can just click on edit here and it gives you the drop down boxes or fill in boxes, whichever is necessary. So these are fairly simple questions. This is where it gets more difficult and we have a script for you. For those who are new, I'll be attaching that here and in the Telegram for you. And then you'll be getting it later in the context of our manual. But for now, you'll just have and they're working documents. So if you see some questions in there or some different colors, it's because we're still working with them. But you'll have the questionnaire so what you'll do is you'll be asking them for, who have they been in contact with in the 14 days prior to them having symptoms. And this is the information you are going to be asking them for the contacts, because you will then be contacting these people. So we want to try to get their email if we can. Definitely need to get a phone number. And then the date of the contact. If there's any notes here, you can put in notes. If they're belligerent, if they have questions that you need to get back with them on, you have a place where you can have notes here. And we'll see if I put in a note, does it let me know that there's notes? So it lets you know that you've noted something there. So when you go back, oh, I've got to look at my notes on this person. Here, this first field, we have either person or places. So this is a person, because you'll get will be access to a larger sheet where the person contacts and the place contacts are available. This is coming from this person's, and this is here because you can go back to the original page by clicking here to see their dashboard. You're going to want to ask if they were COVID tested, or they're not tested, if they have any positive, if they did they test positive or not? I'm sorry, the camera thing keeps getting in my way. And then Also, if they've had symptoms. And just so you know, we're going to move this. The having symptoms needs to be at the top.
No?
Yes. This will be put at the top because if they've had symptoms, that helps to lead some of the other questions. Shaz, is there a question, Dr. Rana? Okay, and then when you have completed your interviews, this interview, mark it as completed, then you'll know that you're done with this, that you've done everything that they've asked you to do. Does that make sense? Are there some questions on this?
Yeah, actually, I have a question, if you don't mind.
Ask away.
Yeah, so actually, I'm here in the app. I signed up, but what I noticed, like when I signed up, they're asking me information as I am the patient. So I'm not sure, like I'm kind of confused regarding this.
Very, very good question, Tariq. Thank you very much. Right now, because we're in the process of testing, so what we've been doing, and we'll be changing again. So this week, for 2 of the days, you will be a patient. And then for the next 2 days, you'll be a CTS, because we're still working out all these bugs in the app. So right now, you're signed up as patient. That will change after today, or it may be the same, but this week you'll have the chance to be a CTS and a PUI, Tracy, patient, whatever we're calling it. Does that make sense to you?
Got you. So I'll keep signing up, and then from your side, you'll switch me.
Yes, Camilla will be changing that. Yeah.
Got you. Okay.
Okay.
John, I had a question as well. Actually, I had 2 questions.
Ask away.
This is Isha, by the way. So firstly, once we've selected, say the patient has symptoms, within the notes section right up here, you mentioned we should write down patient is belligerent or whatever, specifics to their case. Do you expect us to also put sort of an HPI, like patient has throat pain, rhinorrhea, that kind of a thing?
That's more of a Dr. Michelle question. I don't think so. I think mostly what we're trying to do is make sure that they know that, one, that they've got a way to track their symptoms. That's for their care. Secondly, that we can inform their contacts of their potential exposure. And thirdly, that when the disease has run its course, that they're eligible to give plasma. So we're not doing anything that's diagnostical. I don't think we're making this available to doctors for information. That's between the patient and the doctors. So this is more notes for you that you want that's going to help you in this process. Or for example, if you're talking with a minor, this is a place you can document here that you got permission from the parent and get the parent's name. So that's where this would be important.
Mm-hmm. Okay, makes sense. My second question actually was, for those of us who are volunteering from out of the country, how are we expected to make the phone calls? Like, are we going to be making international calls? What's the method of contact?
That's not something that we've dealt with yet, but it's a good question. I would say probably you'll have to use Skype or something. I mean, not necessarily the video Skype, but something. We don't have the infrastructure to.
But I think we could activate Google phones. Those Google phones.
So yeah. So, but thanks for that question. Keep keep asking us, and we'll figure out a way to do that. So.
Yeah. Thank you.
Dr. Venkapal, someone's asking, why is there a star next to David's name?
Oh, good question. Camilla, why is there a star next to David's name? And where do you see that star? I don't, on this page.
I don't see a star too.
Okay, there was
the
a
star.
star.
Is in the list on
that's
the
because,
person's page.
Yeah, so that, so I want to get back to, oh, that was his page. I'm sorry, I'm still learning the app too.
Go down to the list.
Go into this list. Oh yeah, here we go. So the star is because I finished with it, because I clicked complete.
Yeah, because you put completed. So I put a star there to signify all the completed ones.
So when you go back into, so if you're working for 2 hours, you're like, I just can't do any more, you can leave this and you can come back, and those that you've completed, there'll be a star there. So you don't have to try to remember, who do I need to call?
Now, John, I want to show them the workflow for the two systems, because this one was for the initial contact. For the contacts on this list, we're not going to be contacting them. We're not going to be working from this list directly. I wanted to see if you could show them the method.
Isn't that, don't I go here and where is that?
First, you have to place the patient, the contact. First, you have to put this person in patients in contact. Go up to the top to your controls.
Okay.
Right? Patient status.
Okay.
And then you have to put it in contacts, interview, and process. So when you do this, go back to your dashboard. Go back to your dashboard, yeah. Once you signify that, now you see how the list CT people says 7. Click on it. Once you put a patient into that category, all of their contacts and locations will go into this list for you to easily start working this list and just go off by it. When you complete it, it falls off this list as well.
So this has everybody for all if you have multiple tracees, then all of their contacts are here. Is that right, Camilo? Camilo, is that correct? So this is where all of the patients for all of the contacts, if you have 2 or 3 tracees, they will be all populated here. And then you can go to the individual pages. So let's see what Michelle Obama is doing. So we would know that we're talking with Michelle. I had this information. Now I need to call her. And then again, these are the questions I'm asking her. Okay. And then when it's completed, and we'll go over the script in just a second, then I say it's completed. So her name should be starred here. If I go back to,
so you see that person fell off the list.
There, and she's starred down here. So one thing, so that's the people, and there just one other thing that you're going to be asking your the COVID positive patient for places they have been, and that's what you start putting in down here. And in those, oops, sorry, this is one thing I'm still learning how to do all this. Go back down here to places. I want to add a place. And you have, we've changed these. This is old on mine. You'll have the name of the place or person. So let's say I went to local pet store, and then address will be next. You could, and if you don't know the address, maybe it was in a mall. You don't have to put the name of, or maybe you know that it's on 12th and MLK. So exact address isn't important, but the location is what's important. If you can get a website and a phone number, that would be helpful. If you can't, because we've got the name and the location, we can find that out. But you want to find out where they were for longer than 15 minutes and close contact with others who potentially could have been exposed. That's what we're asking for here. Again, we've got some notes here if you want to note anything down. And then when I save this, it's going to populate into this. Again, we've switched this, so the name of the store will come first and then the address. So those are the 2 things that you'll be working with this week on the with your in the practice run. Are there any questions at this point?
John, I have a question.
Okay.
So how do we follow up the places? Like, finding out if there were places, how do we follow up with the people who were exposed
Okay.
in those places?
Right. I'm going to be going over the script for the people. Don't have one yet for the places, but we have one for the people. So that's what we're going to do next, is talking about that script.
Okay.
Okay, Dr. Venkapal, someone's asking that they're trying out the app right now, and every time they save something, a very loud and startling sound plays. Is there a way to fix that?
That's a Camilo question.
Sorry guys, I started putting the sounds in. That was from like a week ago. It's just alerts whenever either they have a shortness of breath or they have a patient that has an alert.
Okay.
They will receive a sound notification.
All right.
Okay.
Dr. Venkapal, if a patient does not have insurance, what about the testing then? That's a question from someone. How do they get the COVID testing done then?
Dr. Michelle, do you have a response to that?
I'm sorry, repeat the question again.
If someone has no insurance, how would they get the COVID testing done?
There's a lot of, we actually have a list of where it's available for free. So
Okay, awesome.
there are a lot, there are a number of sites that are available for free. Also, if they go to any emergency room, it's covered by the government.
All right, awesome.
They can go to cdc.gov and it'll direct them to the non-payment testing.
Yeah, I've seen some Florida Department of Health sites that have free testing.
All the health department entities.
Okay, we need to get those in our instructions on how to find that information. So thanks for that question.
Awesome. So they're saying the consent from minor, is it only parents or a grandparent or an elder sibling can also give consent?
Any relative that is related to the patient, either legally or just by natural birth, they are over 18, they have to be asked the question to assume the responsibility of allowing the child to do that. And then it's their job to go back to the parent and say, the contact tracer's called. I said it was okay for them to talk to your daughter or my niece, and then you're good to go.
Okay. Now, can the CTS use this app on the phone or do they have to use the computer?
It's made for both. It's for all platforms.
All right. And after waiting for 14 days, should the person get retested for COVID? Do we have anything for that?
There's discussion right now about, there was a discussion in the earlier months of the disease, and the science behind the SARS-CoV-2 is that the original thing was to come back in 2 weeks and get tested again. But I think that has since changed to people are getting one test either through the nasal to see if it's active or the serum to see if they've had it before. And that seems to be suffice for now. Is that correct, Dr. Jack?
Repeat that again, Patrick.
So in the beginning of this pandemic, there was a discussion about getting 2 tests to confirm the test that you took prior on the second one. So to make sure you're positive or negative, to continue that way. There's some academic research that's going on right now that are testing multiple people at multiple times just to test the efficacy of the exams. But right now, for your facility, Dr. Jack, at Larkin, you are only testing these patients once, either nasally or through serum, right?
Yeah, if you're talking about drive-through testing, like initial testing, we're only testing them once. That's correct.
And I think that the question was about, so after the 14 days has passed and they're feeling okay, do they need to get another test?
That's if they're a healthcare worker. So there's a CDC, advisory on that. We could look, if you can't look it up, we can always send it to you. But so what they recommend is if you are feeling better, you can actually 7 days later, you can, after testing positive, you can just wear a mask and you can actually go to work. Some works require you to have a negative test. if you work in a healthcare facility, you need 2 consecutive negative tests. That's the only reason you would need 2 consecutive negative tests.
All the
So
mon-
it sounds like our response is more, it's very contextual depending on where
Correct.
they work and where
Correct.
they are. So the one thing is to refer them to the CDC page.
Yep.
Talk with their
In
PCP.
reviewing,
PCP.
in reviewing the
Refer to the-
existing protocols that are for CTS training, all of them address the test once. They don't say anything about going back and doing it again.
Because that's really for healthcare providers. It's mainly if you work in a hospital, that's why they want to kind of verify that you're negative before you go in and possibly expose people. That's the only reason.
Okay. Super. All right. Well, I'm going to move on because I want to be sure that we cover the next 2 pieces. This is.
Wait, one thing, John?
Yes.
I just wanted to touch one more thing, is the not ready and the ready.
Okay.
So when agents are ready to receive their next patient, can you just show them that button so they can see? Yeah, go to the dashboard.
Hang on. This one right here.
Yes. So we're gonna change that color to make it pop out green and red, but for now it just signifies that you're ready for your next patient. And when you receive a patient, it turns automatically to not ready.
So we keep on adding features, and we really like your feedback in the Telegram. It helps us to make a better product. So if you have ideas or thoughts or something that helps that's not working, please let us know, and we'll do what we can to make it work. Okay, this is the app or the questionnaire that I'm going to be putting on both this presentation, but as well, I will put it in the Telegram. Give me a few minutes after this so that I can figure out how to do that. But this is again, these are guides. You don't need to read this. Please don't read it. Actually, make it your own. What we'll be doing, so review this several times. Even, think about it in the context of the AASHTO training, because a lot of this comes out of, and think about it in the process of the information that you're getting from the people. I would encourage you to go and look at this document here. It is highlighted here. It'll take you right to the document on guidelines for talking for contact tracing interview, help you prepare for that. We want to be sure that you let them know that you're calling from the Larkin Community Hospital. That gives us some credibility, and they can check on, you'll see now if you go to the Larkin Hospital website, there's a presence there for the COVID Fighter app. We do include that they let them know that if they're want to check to be sure that they're over 18. So that's a way of introduction. Also, remember as you're doing this, especially with these people, these are the previous interview was for people who are already active. Please mute. Okay, thanks for muting. For the first interview is for people who have already, they've said that they have, that they're COVID positive. These are people that they have no idea you're calling them, probably. They might know, maybe their friend has already told them, but this is where you need to show some empathy and some understanding. So let them know that, you can understand this is unsettling, you're not here to scare them, but that you want to, help them get through this and to be able to help mitigate the spread of it. This is also a time when we want to clarify that you're not calling as a healthcare provider. Very important to tell them that, and that this information is confidential. So those are some important things to cover in the beginning. Once you've talked with them, you might, the first thing we're suggesting is find out, have they been showing any symptoms? And then from there, you'll know what to do. If no, you'll want to tell them about what it means to be quarantined for 14 days. And if they say yes, then you need to talk about being isolated. One thing that we want you to do is try to help them make a plan that's down here so that if they need to think through, oh, how do I do this? How do I get, make sure that I've got food. What if I've got 4 people in my house and we only have 1 bathroom? There's just some conversations to have with them. You don't have to solve these things for them, help them think them through. And hopefully they have somebody in their home or family that can help them resolve this. If they have other issues, social issues, those are outside our ability. But if you have information as to where they can get food bank or other help, that would be probably very helpful for them. One thing you can remind them is just if they have some other health related concerns or maybe a need to call 911, let them know that they can always do that with this disease and some interactions that they're having. And then as you're closing out with the information gathering, ask them if they, be sure that you ask them, let them ask questions, some doubts, some concerns that you can hopefully provide for them. And then if they happen to be, if they are COVID, if they are showing symptoms, it appears that they are, they could potentially be COVID positive, be sure and tell them about the COVID Fighter app that they can sign up. You can sign them up right there. You can, there's going to be a feature on there for them to, you can add them while you're talking with the contact. So you can walk them through that. So I'm not going to read all this. I am going to put this out there for you to go through. As I said, familiarize yourself with it. Really understand the context with the training that you've had and with the app you have. Play with the app with this. And then we have an assignment. But before we get to the assignment, are there any questions about this at this point? Okay, then I want to bring up our assignment for this week. And I'll be putting this on the Telegram. It's going to be a little bit more complicated than the last ones. It's not any more complicated in the sense that you will get assigned either as a CTS or as a COVID positive person. But the purpose is to really practice with the contacts of the COVID positive person. So you'll get an assignment from Camilo. And if you're a CTS, you don't have to call your PUI. The only reason you need that PUI is that they would respond to the app so that you have the fields are populated, because you need a patient or a PUI in order to fill out the contacts of the PUI, okay? You can call them, I mean, if you wanna do another practice run, and for you new people, feel free to call that person up and follow the first script and go through the interview with them. You are welcome to do that. And if you get the advice that you're a PUI, please fill in that information, because if you don't, the CTS is not going to be able to finish their portion of this exercise. Okay? And then from there, also, you're going to receive 2 contact names and phone numbers from your region head. Region heads don't know this yet, but it's an assignment you're getting now. In order for this to work, we're going to divide the regions up. This is how I'm looking at dividing them. Regions 1, 2, and 5, region 4, region 3, 6, 7, 9, and 10. And if you all would take, amongst yourselves to coordinate this, assimilate your names and phone numbers, and then distribute 2 to each person. This way, when you are filling out the contact, each person will have 2 contacts that they can be calling. So you will play a fake contact if you get a phone call. And then that's where you go to the contact section in the interview, and you will want to fill out those forms or those questions with this contact person. Is that clear as mud, or What questions do you have?
So just to clarify, if you're assigned as a PUI in the app, we should just make up like information and put it in there?
If you are, yes, you just, as a P, yeah, you just fill in the information. You don't have to use your real name. You would need to, if you want to play the, be the person under investigation, you do put in your phone number and your email so that they can contact you. If you don't have that, they won't be able to contact you. So, but the importance is that the CTS for this experiment just need to have a populated field. But put in your real information, let the CTS, actually that's a good one. We have new people here. It would be great if you'd be willing to be a fake PUI, put in your actual contact information so that new people can make that phone call and try that out. Thanks for clarifying that, Isha.
Okay, thank you.
Other questions at this point?
No, Dr. Van Kapel, we have no questions right now.
Okay, or none that are written, but anybody have anything on the phone that they want to ask? Okay, I will be sending out 3 documents. Everybody on the Telegram will be the script for the Tracy or the PU that you're asking for the PUI. There will be the script that you will be using for the contact person. And there will be this assignment so that you're clear on what you're going to be doing this week. And if you have questions, the Telegram is a great way to be asking. If there's no questions at this point for this assignment, then we'll finish with that.
I have one thing, John, if you don't mind, it's Virginia.
Please.
And I'm shifting gears. Thank you for all that. And I know that once everything gets in everybody's hands and you start using it, this will become more clear. But you saw my Telegram notice this morning about trying to do the school challenge, that we have so many volunteers who are in school. And Don Hathaway has agreed to help coordinate that. And as you can see, that we have X number of volunteers, but we have Y number of volunteers who actually are involved in this, even though there's a big number. And so we need more volunteers, and we all need help. And so it seems to, if we can start with the people we know or the places we have connections with, that it would help this steamroll of volunteers to be recruited. So toward that end, if we can somehow create a campaign for the schools to get a recognition when their school recruits the most volunteers. We have the volunteers by schools. There's a group of volunteers in several schools. There's a lot of schools that only have 1 volunteer, but they could band together and be, I don't want to say the misfit schools, but the schools where they're the only ones. And just see what kind of traction you guys can get amongst yourself when we have 62% of this group who are in medical school, and you guys know a whole lot of people in medical school, that it seems like it's a avenue that is worth exploring. Don, is there anything that you want to add to that? Maybe he's not even on anymore. Are you on, Don?
Who are you asking this to?
For Don Hathaway. He may not be on. So anyway, I will tell him that I raised it. If you guys, he's on Telegram, he's in Region 4. He's also in the SGU group. So hopefully you guys can get excited about trying to recruit people and build these numbers, because we are going to need them. You see how much work this is for each CTS. So
I have a question for
Virginia,
Jack, and John. My daughter is 18. She just graduated high school, but 18-year-olds that are in high school are in a program called HOSA, and it's a healthcare preparedness type of program where they all become MAs prior to leaving high school. But if they're 18 and over, can we use them as a workforce?
They're
OSHA's
volunteers.
OSHA's national, so we can contact them.
There's no reason why we can't.
Okay, great. Camilo, just any other questions about that? I was going to ask Camilo, will you be resetting the updated app today and sending out assignments? Is that correct?
I already started assigning.
Great.
Anything that we have to update, I've made it so we can update it in the future as we go.
Okay, very good, super. I just got to, really hats off to Camilo. He's really doing a great job. He fields lots of questions, and then he gets on the phone with me and I ask, well, what about this? What about that? And he's got a family and a job and a business. So thanks so much, Camilo, for your really hard work, your dedication to this. It makes a huge difference. It makes it possible. Without it, we wouldn't be anywhere. So
Thank you, John. You too. You've been a lot of help.
So I just also want to say next steps, what's happening. So we want to finish this this week. You guys you're great, really. If without your input and the use of this and walking through the mud with us, we wouldn't have anything. I hope that in the sometimes the frustrations or the lag time that you're really able to realize that this is the beginning of something that we hope to see really big. So you're having you're playing a big role in this. But what we're working on right now is developing a manual that covers the pertinent information for contact tracing and the specific information for working with our app and working with the COVID Fighter. So we're nearly done with that. It's like all of this, there'll be several iterations. We might not get in all of the different scenarios you may run into in this first iteration of the manual, but we're going to have the basics so that you can be really good contact tracers and you are going to feel very confident by the time you make your first phone call. It'll be scary. It'll be, you don't know, who you'll be talking to on the other line, but you will have the tools that you need and the skills to be able to engage with these people. And so hang in there with us next week. I do hope to be sharing the manual with you. And I know that not everybody that's with us can be here on Monday, so we'll make it happen a couple times during the week so that everybody gets exposed to this and we're ready for June 1. So I don't want to take any more time. We've gone longer than I had planned, but are there any final questions before we leave?
I have one, sir. Do we confirm their identity? Because there was a course saying that the Coursera course has 2 identifiers for the patients, like what's their date of birth and their address.
Go ahead.
Okay, so in that course, I think if you check it again, and correct me if I'm wrong, you can email it, but it states that after they're talking about those 2 forms of identification, I think the moderator also states that you get what you can. It wasn't a mandatory thing from what I recall. Is that correct, everybody?
That makes sense. You get what you can.
Yes, that's correct. Get what you can.
Everyone understand, any of these cases that we're doing that need public health response from the institutions, they will get it. So this is why we need to keep communications with director head or whatever the administration heads are, so that we can contact the authorities when necessary. And again, it won't be a lot of cases, but it can come up.
Okay, thank you.
Thank you, everybody. Thanks, John.
Thank you all very much.
Thank you.
Look forward to your comments.
Thank
Good
you.
work.
Thank you.
Thank you.
Thanks for your work.
Have a nice
Thank
day.
you, everyone.
Have a great
Bye-bye.
day.
Thank you.